Welcome to Defining Abnormal Behavior. Take a minute and think about what is normal. If you had to give me a definition of normal, how would you decide what was normal and what was not? And if you think about all the things you use to define whether or not something is normal, do any of those have problems? Our concept of normal tends to be one of those things that people, they know it when they see it, or perhaps even better, they recognize normal when they see something abnormal. But in real life behavior, it can be difficult to come out of nowhere with a new definition of what do I mean by normal. And a lot of our definitions have important flaws. There are several different criteria that people use for deciding whether or not something is normal or abnormal. Here are some of the most common things that people use. Whether or not something is statistically anomalous, meaning it's incredibly rare, it almost never happened, you have very few examples of it ever happening. But think about a problem with that. That would mean we would say winning the lotto is abnormal in the sense of bad. But I imagine most of us would say, hey, if I win the lottery, I'm going to be really happy about that. Even though it's very rare, being statistically anomalous is not enough to decide that something is abnormal in a problematic way. Defying social norms or being culturally unacceptable. If we use this definition of normal and abnormal, that would mean anytime we go into a different culture, we would look at the things that they do that aren't similar to us, and we would decide that those things are abnormal. Or imagine, how do we create social change in society? We have to defy social norms in order to change society and create new norms and create new policies. So if we never had anyone defying social norms, we would never also have social progress. So that shouldn't be enough to say something is abnormal. How about suffering? Having clinical distress, damaging relationships, impairing school or work. That's the way we would typically think about abnormal in a clinical sense, that they would be having distress, damaging their relationships, or they'd be impairing their school or work. But is that sufficient for defining something as abnormal? Think about someone who suffers in order to relieve someone else's suffering. Or they find themselves in distress, but it's a situation that they should be distressed by. Would we want to say then that that's abnormal, or is that normal? If something is frightening or dangerous, well, this often feels like a no-brainer. If something is frightening or dangerous, then it must be abnormal. It must be bad. But I jump out of airplanes. I ride a motorcycle. These things can be frightening to some, but not all. These things can be dangerous, but that doesn't necessarily mean that we don't want to have those kinds of experiences. So frightening and dangerous maybe still isn't enough to decide that something is abnormal. How about misperceiving reality? Seeing things that aren't there, hearing things that aren't there. Well, this again feels like it would be a really clear-cut case that if people are seeing things that don't exist, then that's problematic. But what about a shaman who is deliberately going into a trance state, or someone who is using psychedelic medicines in order to achieve a different reality state? Is that enough to say it's abnormal behavior, abnormal in a problematic way? How about maladaptive? Here we're typically thinking maladaptive in the sense that they're interfering with managing their life goals. But wouldn't we all say that we have times where we are not actively striving to reach our life goals? Would we think that that's always going to be something that's abnormal and problematic? And harmful to self. Here, if somebody is doing something that would inflict harm to them, then we would typically think of this as being abnormal. But is it enough to say this is abnormal as a bad thing? Well, consider someone who volunteers to go into war, and perhaps they even put themselves in harm's way and they're injured, but they were rescuing a child from a fire. Are those behaviors that we want to say are abnormal? The bottom line is, we're hesitant to label someone as abnormal on the basis of the first two criteria alone, being statistically anomalous or defying social norms or being culturally unacceptable. We want to have more than that to decide that something is abnormal in the sense of this is pathological behavior that we would consider for diagnosis. In fact, if we take any one of these examples here, even the ones that seemed most consistent with psychopathology, misperceiving reality, even those have caveats where we would not want to necessarily assume that we should define this as abnormal, meaning pathological, and think that this is someone eligible for a psychiatric diagnosis. We want to go further, we want to investigate more, and we often want to put multiple different things together in order to make sure that we're really looking at something that we should call pathology. Here you have what's often considered a more official use of the term, as well as some related terms. So when we're talking about abnormal behavior within the confines of our class, abnormal psychology, we're thinking of it as a psychological dysfunction associated with distress or impairment in functioning that is not typical nor culturally expected. So what's happening in this definition? There's several different important points. One, with only a few exceptions, it has to be something that is causing the individual distress. What is this getting at? I'm allowed to be weird. I'm allowed to be quirky. I'm allowed to be different from others. That's not enough to say that it is pathological abnormal behavior. So I should experience some distress, and there are some disorders where this does not count, and we'll come back to this definition and talk about that again. And if it's not causing distress, I should have impairment in functioning. So impairment in functioning, we typically are thinking of, it's disrupting my relationships, it's making it hard for me to do my job. Without that, we should not be considering it psychopathology. On top of that, we want to consider the cultural norms, and we don't want to impose our norms and beliefs on others. And so if we're working with someone and their behavior is different, we need to find out, is it only different to us because we don't know the cultural norms? Or is this individual's behavior defying the norms of their culture as well? Putting that all together means it's going to be very rare that we can automatically determine that something should be designated as abnormal behavior, because it's complicated. We also, as a field, we're moving to using terminology and labels that are more considerate and thoughtful about the individuals who might have these disorders. You'll see there's a movement in the field to talk about psychological disorders and to talk about psychopathology, and to do so with person-first language. So instead of talking about somebody as the schizophrenic, there's reference to the person with schizophrenia or someone with schizophrenia versus that schizophrenic parent. What do you think we need to know if we want to determine if a behavior is normal or abnormal? I invite you to come with me on a journey as the psychopathology detectives and think about this case. CJ was discovered defecating in his closet. What would we want to find out as good psychopathology detectives in order to determine if this behavior is normal or abnormal? And take a minute here, stop the video, and write down all the things you can imagine you'd want to know before you made the final determination on whether or not this was normal or abnormal behavior. Well, here's a list of several things that might be important to know before you decide on whether or not this behavior is abnormal or normal. So 1, CJ's age. If I told you CJ was 33, or if I told you CJ was 3, would you feel differently about whether or not this was abnormal, as in pathological behavior, or normal? We'd probably want to know CJ's physical development and mental development. Is there anything going on emotionally, psychologically, or intellectually that might lead to this behavior being part of normal functioning, or certainly not being seen as psychopathology? Are there any physical ailments? Perhaps DJ was really sick and couldn't get to the bathroom. We'd think about that differently than if he was not sick and there was nothing physically wrong and he just chose to go to the bathroom in his closet. Might also want to know, how frequent does this behavior happen? What's CJ's explanation for the behavior? How does CJ react when being caught? If when it happens, CJ doesn't seem to care that anybody noticed, doesn't think it's a problem, that might change our understanding or perception of it. And we'd probably also want to know, has there been any recent change in CJ's life? Has there been any recent traumatic events? So this is just a handful of the many, many things we would like to investigate if we have a new case and we're trying to figure out if this represents psychopathology or normal developmental behavior or a normal response to particular events, like maybe being too sick to get to the bathroom. Hopefully what this shows you is there's no way of identifying a single behavior and automatically knowing whether or not it's normal or abnormal. Because with context, with understanding the particular case, we might learn details that shed light on how normative the behavior is or is not. Previous approaches to conceptualizing abnormality are important for us to understand. And even though we've moved away from many of those past definitions or ways of thinking about abnormality, their influence still persists to current day. What we can say is that across time and across all cultures, there have been psychological disorders. So it's not something new. Psychological pathology has existed across all cultures and across all time periods. But what does seem to differ is how different cultures and different times explain those behaviors and explain why they happen. So whatever our reigning paradigms are, our major worldviews are at a time or in a culture, will influence how they saw the world, how they saw psychopathology, and what you'll see in a moment is the way we view the cause of disorder then influences what we think is an appropriate treatment model for that disorder. During the supernatural tradition, the belief was that deviant behavior was the result of a battle between forces of good and forces of evil. And so those who manifested symptoms of mental illness did so because they were either possessed by the devil, they were engaged in witchcraft, or witch or sorcerer had attacked them. There was also a belief that perhaps it was due to the constellations or the moon, which is where the term lunacy comes from, luna being moon. And because they believed that these things occurred from things like demonic possession or deciding to cahoot with witches, you saw that the treatment options that they followed matched those beliefs. Treatment involved exorcism, torturing, beating the people, or crude surgeries. Here are two skulls from early Peru. These skulls have been subjected to a rudimentary form of treatment for psychological distress and psychological illness called trephination. Holes were made in the skull to allow the evil spirits that possessed them to fly out of their head. And by opening up this hole in their skull, it created that space for the bad spirits to leave their bodies. Often survive these events, although they may be very fundamentally changed after damage to their skull like this. Over time, there was a transition where they began to think of biological approaches, and we'll talk a little bit about those. And those actually came into vogue, and then they disappeared again and were replaced again by the supernatural tradition. So in the Middle Ages, we saw that the primary belief was that possession was the cause of mental illness, and so they focused on prayer, exorcism, starving out the demon, or trying to torture the demon out of the body. Then there was a period focused on witchcraft. And this was particularly important time because the belief here was not that a witch possessed them or put a spell on them. The belief was that witches voluntarily chose to work with the devil. And because of that, it was okay to do whatever you needed to in order to diagnose them. And this is where we get this term of damned if you do and damned if you don't. because their attempt at trying to diagnose whether or not they were a witch led to them dying either way. For example, they would tie them to a rock, throw them in underwater, and then pull them out 30 minutes later. So imagine, probably didn't survive that test, but if you did survive the test and they pulled you out of the water 30 minutes later, then they would kill you. So you were going to die either way once you were accused of being a witch. What's also important here is that this was not really about mental illness. What was typically happening is that those individuals who were uncomfortable for society, perhaps they were unmarried, maybe they were poor and begging others in the street, maybe they truly were mentally ill and they were wandering the streets, that these individuals were targeted and denounced as witches. And it became a convenient way of getting rid of those who made society uncomfortable. The second group of women that were primarily targeted and being accused as witches were those women who began to practice midwifery. So they learned the medical skills necessary to help other women have their babies. This was problematic to status quo because prior to that, men were thought to be the only ones who were smart enough and capable enough of having medical knowledge, and they were the only ones there at a woman's delivery. And as women began to learn medicine and help other women, they interrupted the belief about the hierarchy about gender and also financially interrupted those men that were making money in this way. So they were often accused and subjected to tests that resulted in their death either way. And in particular, there was a document that was passed around called the Malleus Maleficarum, literally termed the witch's hammer, which was a manual for hunting witches and then diagnosing whether or not they were witches. And this was written by 2 priests, and this document alone led to over 100,000 women being accused. And I should say, there were some men and there were children, but over 100,000 people were accused, sentenced, and were killed as a direct result of this document. In the late 18th century, early 19th century, we saw the beginning of the Reform movement. And this was a response to the really despicable conditions in institutions and in asylums that happened during the 1400s and 1500s. So what you saw were these really despicable conditions in asylums where people were really treated in the most inhumane ways imaginable. And they really weren't being treated, they were just being housed. And this led to the rise of moral therapy. And this isn't moral as in religious or a sense of morality, but the idea was normalizing, providing treatment for those who had psychological disorders. And that if we provide people with humane treatment, it would lead to a decrease in their psychological symptoms. And so here people were unchained because, yes, they literally were chained to walls, perhaps for days at a time. So unchaining patients, allowing them to have walks, art, fresh air, not engaging in any type of humiliation or abuse, feeding them, clothing them, keeping them bathed. And what you found is a lot of people did improve. However, the moral therapy movement did fall out of vogue because a lot of people came to believe that mental illness was not curable. And for many cases, it was indeed the case that maybe people got a little bit better, but they still were unable to live independently and had to be institutionalized perhaps for the rest of their life. And there began to be a shift in why are we spending resources on helping some people get just a little bit better but still be institutionalized forever. We should not waste these resources and divert them to people we can actually help. During the same time as some of the early demonological model theorists, we also saw that there were early medical models that emerged. And these eventually paved the way for some of our current theories, even though what they proposed actually was not accurate. So one, this idea that abnormal behavior is a physical disease was a really important break from the idea that mental illness was the result of demonology or being possessed. And here we saw that the 4 humors were now considered to be the cause of mental illness. So we had 4 vital fluids, one being phlegm. So an excess of phlegm was thought to result in sluggishness. Black bile. Too much black bile would lead to depression. Too much blood would result in an optimistic, happy-go-lucky person. And too much yellow bile would lead to an angry disposition. Modern day, we know that there is zero truth to that. But think about how it relates to things we do know, like an excess or a deficiency in certain neurotransmitters can result in certain dispositions and certain psychological conditions. So it did lead us down the path to where we eventually went, even though they were not quite right. Galen further extended this work when he discovered that the arteries in our veins carried blood and not air. And so this now further grounded our belief that there were biological processes that were determining how people felt emotionally and physically. But again, led to rudimentary treatments. So bloodletting, using leeches, things to draw out the blood because they thought the blood was what was carrying disease. So in sum, even though these early traditions were medical models and they were not quite correct, they did link abnormality with the direction we eventually went with understanding brain chemical imbalances. And it foreshadowed our modern views in how we see psychology today and what we know about the biology of most mental illness to current day. So they were wrong, but they did lead us on the right path.